My dad was a great dentist, and he started the practice that we're in today back in 1929. At first, he would bring me down as a teenager into the office and had me learn in the laboratory and just listen to him. He would take me down on Saturdays, and he said, I work half day, and if you stay with me in the morning, just around learning what I do, we'll have lunch, and I'll take you by Muses. They always have a sale on Saturday. And he says, I'll buy you a present. Well, I love that. So that's what I did. And I learned that it wasn't just about what he did with his hands, although his hands were wonderful. I was amazed at how he talked to patients and how patients loved him. They would look at me and say, if you could be half as good as your father, you'll be a great dentist. That's the legacy that I had to fight. And during that time, he would say, you don't have to owe me anything if you don't love what I've done for you. You'll owe nothing. He did beautiful dentistry. I think there's only one patient who didn't want to pay him. He was not very nice. So Dad said, that's what I told you, so you don't have to owe me a thing. He said, if you want to give a little bit to charity, I'd appreciate that. We had to have patients who appreciated what we were doing, and they would tell their friends. It was a very, very, very large practice. My first patient was a very famous basketball coach. He was ashamed of his smile. He never smiled. And my dad said, you're going to do the transformation for him. So that was my indoctrination. We took beautiful girls, 2 years Miss Atlanta contest, took pictures of them, and when we surveyed them about how they felt about their smile, 95% of them hated their smile. And when we asked the next question, why didn't you do something about it? And the answer was, my dentist thought I was cute enough. Dentistry did not appreciate the demand for aesthetics. We need to change the profession. That's what I told Dad. We're going to change it. And to do that, I had to write a textbook. There wasn't a textbook with the complete study of all the professional societies in dentistry. It was finally published in '76, but while I was doing all the work to write the book, which took 7 years, I came up with the fact that if I'm learning so much in all of this from all of the different specialists, we need to be doing that as a group. I think we need an academy devoted to aesthetics. It gave me a passion for not only what I was doing in dentistry, but to change the profession of dentistry. You have to love and have passion for what you do or do something else. My dad had a great practice, and we're the continuation of it. We call it 2.4, the current team. They are the best of the best. 2 of them are prosthodontists, Marco Tadras and Marcelo Silva. They finished my program that I started at the Medical College of Georgia in aesthetic dentistry. So they had, by far, the best qualifications. Both prosthodontists studied advanced work in aesthetic dentistry. And when they came, also came was Dr. Maria Paranos. She was the wife of Dr. Silva, and she had her master's in dental materials. She's a super dentist. She works on me. So, and I can tell you, she does everything under rubber dam, and she is just a wonderful dentist. So this is our legacy. We have Dr. Apteen Shari, and he is a master in oral surgery. We have added Dr. Tony Salama, Dr. Salama's niece, and she is a wonderful periodontist and a great surgeon. So we've expanded periodoprosthesis plus aesthetic dentistry throughout the office because they're lecturing all over.
How do you think your dad would feel seeing the practice today if you could?
Oh my God, he would be so proud of what we've accomplished and what we're doing today. It's dentistry of the future. It is a practice for the future, and that's the legacy that I'm so proud to leave.